All right, so I want to talk about some of the procedures that we do in the setting of a failed instability surgery, right? So, instability is an incredibly common problem that we see in the shoulder. Think of your shoulder as a golf ball on a tee. You've got your humerus here that becomes a ball at the top, and then this is your scapula, and at the neck of the scapula becomes called the glenoid, which is where the humerus articulates, right? So you've got essentially what we call is it's like a golf ball on a tee. And so this joint is great because it's got a ton of motion. It's got the most motion of any joint in our body, but that comes at a price. And the price and the cost is that it can become unstable, right? So what often happens with, it can be with athletes or it can be with people that are just, playing sports or just living daily life. The shoulder can start to kind of slide in and out of the joint and it can completely dislocate. And when you typically have your first or second dislocation, the procedures that we do to fix that are going in and using little anchors to repair the capsule around the shoulder to tighten it up. Well, unfortunately, that procedure can fail, right? And it can fail with having a repeat injury, or sometimes if you've dislocated enough times, you have maybe lost a little bit of bone from the socket. So your T is a little bit smaller. And what we know from our literature that the more bone loss you have, the more likely a soft tissue procedure is going to fail. So let's just talk about what we do in that setting when you either have too much bone loss to either do a soft tissue procedure or you have failed a soft tissue procedure for instability. Either you're still loose or you're still dislocating. So there's many surgeries that have been described for this. The majority of them involve using some sort of block of bone to expand the glenoid here to make it give you a quote unquote bigger T is the way we think about it. And I've tried many of them, but the main one that I use, it's kind of the workhorse for me. It's what's called the Laterjet. And what the Laterjet is we go in and we actually take the coracoid and we cut it at the base, and we take this coracoid bone and we move it to the glenoid here. So you're cutting this bone here and you're moving it to the glenoid. And what you do when you take this bone and move it here is you expand the socket of the glenoid. And when you do that, you do several things. I mean, one, you just give yourself a bigger T, right? So you think about this, if this ball is moving on this socket and there's a bigger T, it's going to be hard for it to dislocate. But more importantly, what you do is you tighten up the capsule around the shoulder. You tighten up the rotator cuff. And by tightening up those restraints, that system, think of it as like kind of reins. If there's not a lot of bone, the reins are very loose. But if you move more bone, the reins get tight and it doesn't allow the shoulder to dislocate. So it's both a soft tissue and a bone procedure. The way that we fixate it, there's several ways described. I just used 2 screws. The beauty of the Latarjet, number 1, is that it works. I mean, it is an incredibly powerful procedure. It is supra physiologic, meaning it takes more force to dislocate a shoulder that's had a Latarjet than a perfectly normal shoulder. So it's actually stronger than what you were born with, right? Which is, we can't say that about many of the surgeries we do. So it works. The healing rates are actually much faster. So because you're asking bone to heal to bone in order for you to be stable, what we do is actually we let people start lifting weights 6 weeks after the surgery. First off, right after the surgery, no sling, move it immediately. So we don't have you wear a sling, number one. You can use your arm for daily activities, but we avoid heavy stuff for 6 weeks. After 6 weeks, you can actually start to lift weights and strengthen fairly aggressively, as much as your pain allows. And then after 3 months, we allow contact. Whereas with the soft tissue procedures, it's 3 months until you can start to lift, and then 6 months until contact. So you cut those times in half, which is a huge deal for all patients, right? I mean, everybody wants to get back faster, and to be able to shave 3 months off is huge. One of the knocks on the latter J is complications. And, I trained with a surgeon who's done more of these than anyone on earth. Dr. Walsh in France he did over 5,000. So we did a ton of these when I was in fellowship. So I came out when I started practice, 10 years ago, I had already done tons of these surgeries, and I learned from really the best in the entire world, in my opinion. And that would be most shoulder surgeons would tell you that if you had to make a list of the best surgeons in the world to do this procedure, Dr. Walsh would probably be at the top because he had studied it the most and he had done the most. So our complication rate has been extremely low, and we've had extremely high success rates with this surgery. We don't do it on all patients, but when we need it, it's there, and it's a really, really powerful weapon to have for our patients. And the other thing that's a little interesting about the Latarjet, even though you're cutting a block of bone and using screws versus arthroscopically using anchors, patients tend to have way less pain than they did with the arthroscopic surgeries, which is interesting. You see that sometimes in open surgeries, there's not as much pain in some cases. So the procedure works great. If done in the hands of someone who has done a lot of these and is trained with the proper techniques, the complication rates are extremely low and the healing rates are much faster with the soft tissue procedure. So I love the Latarjet. It's a great surgery. I love doing the surgery itself. It's a fun procedure. And if you are someone who has had a failed instability operation, this is definitely something you should explore as a procedure. You just want to make sure that it's in the hands of someone who does a lot of shoulder surgery because it is a complicated procedure. Every shoulder problem is unique. Make sure that you come in and see a shoulder specialist so we can figure out exactly what the problem is and design a treatment program that fits you.